Amendment would simply allow a grant program to be added inside of this bill that would allow certain entities to apply for the grant to put suicide prevention signs up in their places like decks, bridges, etc. And that's what it does. I ask for your support for the amendment.
Okay, Chairman Lammers.
I endorse that.
Okay, Representative Cunningham moves for the adoption of the amendment. All in favor, aye. Aye. Any opposed likewise? The amendment passes. Chairman Lameth, you're recognized for your bill, sir.
Thank you, Mr. Chairman and members of the committee. And I don't need to spend a lot of time on this because this committee, probably more than most legislators here, understand that in North Carolina we're in a crisis in mental health and we need to do something about it. We've ignored this problem for too many years now, and I think if we don't deal with it this time, we've been a failure in this session. And let me share just a brief few comments. The pandemic and the expansion of social media apps have significantly contributed to our challenges and where we currently are as a state. North Carolina ranks 21st in the nation for adults on the prevalence of mental illness and access to care and treatment. For our youth, we are even lower, ranking 42nd. In a recent edition of North Carolina Health News, North Carolina was given an F on how well we treat mental and physical health issues. For the many families who have no insurance, and certainly expansion will help that, their only option is the emergency room. Look at our history on the time patients wait to be treated or transferred. Within the industry, it's called boarding, and patients can stay for days, even weeks, and that's simply not acceptable. The Strengthening Care for Families and Children Act hopes to reform our state's mental health system. In adults, 2 in 5 report experiencing symptoms associated with depression and anxiety, almost 4 times greater than the previous 2 years' reporting. Within North Carolina, one person on average dies by suicide every 6 hours. That's more than 3 times the number of people who died by suicide during the 2018 and more than alcohol or motor vehicle-related accidents. Suicide is the second leading cause of death among those 10 to 34. Over half of our citizens with mental illness receive no treatment. Now, I could go on, but I think you get the idea, and certainly this committee appreciates our challenges more than most. This bill will utilize $1 billion of the ARPA Temporary Savings Fund that the state will receive to improve mental health. North Carolina has approximately 300 fewer state psychiatric beds available to patients because the state cannot staff these beds. At the same time, on any given day, the state has more than 300 individuals in our emergency rooms awaiting care. Medicaid reimbursement rates for behavioral health services have not been updated in 10 years and do not reflect the actual cost of care, resulting in private providers closing beds. An estimated 200 plus beds are closed by our private employers. We have a once-in-a-generation opportunity to strengthen our care. Thus, the focus will be on opening more care options, providing incentives to staff more beds. This bill strengthens the child welfare and family well-begin systems. Estimates are that up to 50 kids spend the night in their local social services office on any given day here in North Carolina. Provides funds for transporting patients, relieving an already overworked law enforcement system. It invests in better data and management systems. It invests in community and school-based behavioral health programs, and it responds to issues within our justice system. In summary, investments will be made in 3 key areas: to improve access to care, to build a stronger system of support to people in crisis with complex needs, and to invest in building a database through enhanced technology and system. I will pause there and see if there's any questions, Mr. Chairman. I know there's lots of other agenda we need to deal with as well.
Okay. Representative Shepherd, you're recognized.
Thank you, Mr. Chair. Thank you, Representative Lambeth. I'm certainly supportive of the bill. I've got some questions, though, just centered around the fact that we have so many mental health problems in the state. Do we have any statistics that have been proven out that share how many of these are due to drug relations and alcohol-related issues, or children that are born because their parents are on drugs when they were born and they're born as an addict. Do we have any statistics that would point to these situations that are creating some of these issues? Thank
Chairman
you.
Lameth.
That is a great question, and we have anecdotal, as you notice, part of this investment will be to invest in better data systems. We don't have a great database of information. A lot of it is by county or anecdotal, by hospital. But let me call on the staff that's here if they want to answer. Does anyone want to try to take that one? They've been these folks have been working on this for a while now and been working with me. Matt, you want to try to? Yeah, you can come up here. Come up here. Just identify yourself.
Yeah, Charlene Wong, North Carolina Department of Health and Human Services. Thank you so much for the question. I'll comment particularly on the child piece that you asked about, and certainly we know that substance use is a major reason that we see children enter into our foster care system. So some of the items that are included in the bill actually specifically are interventions and supports for families who are struggling, caregivers, parents who are struggling with substance use, because we know that that is, again, a top reason, common reason, that we see children both enter into our foster care system and experience immense trauma that impacts them for their whole life.
Keep you up here just a
Thank you. Chair recognizes Representative Blackwell.
Thank you, Mr. Chairman. Representative Lambeth, I understand that the bill would provide money to be invested in trying to fill staffing positions that are vacant. And that staffing positions being vacant is one of the reasons that we've got a lot of closed beds. But apart from trying to fill the vacancies, would this bill do anything to expand the number of available beds at any of our state psychiatric hospitals, for example? And along with that, would it do anything to enable some differentiation in pay for psychiatrists to try to attract them to areas of the state and state hospitals where they may be less likely to go under the present system?
There's nothing in here for differentiation of pay. That may be an issue we have to deal with at some point. There are programs here, loan forgiveness programs. Within another segment of the House budget, there was workforce development, which would also expand the number of programs to try to get more kids interested, even in the high school level, interested in allied health careers. So they kind of work together. We got to get more high school kids, even middle school kids interested in allied health careers. And then as they learn more about those careers, hopefully get them in tracks, whether it's pediatrics, cancer treatment, or behavioral health treatments, to get them back into the workforce.
No follow-ups today. Sorry, sir.
It was actually part of my first question.
Well, I interpret it as a part of your second question, which is not going to be heard today. But I appreciate the effort. You're always never fail in your effort. Representative Loftus.
Thank you, Mr. Chair. My question is, this is a great start in the funding process. How long will this funding process, there I am, how long will this last? Is this a forever? Will it 5 years, 2 years, and we're done? Thank you, Mr. Chairman.
Chairman Lameth.
Most of it is a 2-year funding schedule, 2 to 3 years, and we'll have to reinvest in programs. And part of the point of the data systems is to identify what's working well and continue to invest in those areas, and what's not working, we may want to not continue those investments. So there's a lot in here that will get us through the next couple of years, but then there's ongoing support that we would need to keep some of these programs going that are worthwhile. Good question.
Thank you. Representative Purtle.
Thank you, Mr. Chairman. Thank you, Representative Loftus. You asked my first question, so I'll do the second one. Is
Don't
these
tell
department
Representative
allegations?
Blackwell that, if you would.
Is these various divisions, allocations in these various divisions, is that a result of what requests come directly from DHHS?
They are. We worked with some community leaders, lobbyists, and the HHS folks to try to put this together. And they actually have a very nice plan called Investing in Behavioral Health we would be more than happy, I think, to share it with this committee that is a little bit more detailed and comprehensive work that they've done.
Thank you.
Thank you. Representative Rania.
A question for the bill sponsor.
Yes, ma'am.
You mentioned that you worked with community leaders and DHHS and lobbyists, but major part of the providers when it comes to our mental health are our LME MCOs. Did you work with any of our actual providers and LME MCOs to create this bill?
Chairman Lameth, you're recognized.
See if the staff wants to talk about that a little bit. I did not meet personally with any of the LME MCOs.
If you didn't, I assume that would answer the question.
Good morning, Carrie Brown, Chief Psychiatrist, DHHS. Yes, ma'am. Not directly in the drafting of the billion-dollar behavioral health resilience investment. However, much of the categories of investment were developed from discussions, particularly with the chief medical officers of the LME MCOs, on the particularly for the child welfare transformation team. We had a broad group of stakeholders, including providers as well as the LME MCOs, that developed the plan.
Thank you. Chairman Baker,
A motion when appropriate.
I believe it's the appropriate time.
Thank you, Mr. Chair. I move for a favorable report to House Bill 855 as amended, rolled into PCS, unfavorable to the original with a referral to appropriations.
Thank you. You've heard the motion. All in favor, aye. Aye. Any opposed likewise? The motion passes. The bill will move on. Thank you. This time, we'd like to recognize Senator Rabin. We appreciate you being with us today. We have a short amount of time, about 30 minutes. We have to vacate the room so it can be set up for